am a professor of microbiology at CUNY. Me and my family, we moved to Larchmont in 2001, and we have been here since that time. This pandemic kind of allowed me the opportunity to put my knowledge at the service of trying to see what contributions we could make to flattening the curve. There's no doubt that we need to keep flattening the curve. And something that I find interesting is that this is a call not only to take care of ourselves, but also to take care of others. It's a disease that really can never be defeated unless we are together. So there's data coming out that shows that we are not equal in this pandemic. If we look at who has higher chances of ending up in the hospital, there's no doubt that elderly people and people with underlying health conditions are the ones who have a much higher possibility of being in the hospital. That doesn't mean that younger people cannot get it, or unfortunately also that they will pass. But in the big numbers, we do have some more susceptible population that we do want to be especially keen in protecting. So if we look at COVID and the racial distribution, the data is really hard to swallow. There's in New York City, the proportion of Latinos who died, the proportion of African Americans who died, it's significantly higher than for other ethnic groups. So something also unique about this pandemic is the fact that this is a new virus. I don't know if you remember that at the beginning, everybody was talking about the novel coronavirus. And what that means is that the scientific community did not know much about it. In a kind of frenzy approach and an effort to try to help, we started to work on the coronavirus. And just to give you an idea, the graph on the right shows the number of scientific papers that are published, and you will see that they are doubling every 14 days. And the numbers are staggering, right? We predict that it's going to be like, in the middle of April, perhaps 6,000 papers. On the left, I chose to show you an image of that was taken with an electronic microscope of the coronavirus. This image was taken from a cell culture. So it means that scientists are really actively working to try to understand the biology of this virus. And that will give us the ability to come up with better ways of fighting it. So I chose just one paper to show you from the very recent publications. And this one is it's work that was done at MIT, and it was published on March the 26th. And in this one, what you see is how far droplets from a sneeze, a human sneeze, can travel. And the really difficult data to swallow is that it can travel as far as 13 feet. So that does not mean that the 6 feet that we are using as a recommendation is wrong at all. It doesn't mean that. But what it means is that it's the minimum distance that we need to keep. So I titled these slides, "What can we do to protect ourselves and others?" And it's quite clear that distance is key. And as I was telling you, the discovery that 6 feet, it's not 100%. The only thing that does is reinforce our need to at least keep the 6 feet of separation between people that do not share the same household. Here is a link to a 3D image that the New York Times has published. I encourage you to see it because it really shows you how the particles travel. The other thing that is very important is that in this effort to protect ourselves, now it's clear that the use of a mask is recommended, but the mask has to be used correctly. And I'm going to show you how to put it on, and as important, how to take it out. So I want to finish with a little summary. So before you go out, before you leave the confinements of your home, you really want to make sure that you really understand and embrace what we call the rules of safe engagement. What it implies is that you are going to do your best to be at least 6 feet apart from anybody else, that you are going to wear your mask correctly, you are going to avoid touching your face, and you are going to wash your hands for 20 seconds, and you're going to do that frequently. So I hope that this information is useful to you. I'm more than happy to answer any questions that you have. And I really hope that I convince you that this is something that we need to do, not only thinking about ourselves, but also thinking about all the members of our community. Thank you very much for listening to me. So I'm just going to show you how to wear a homemade mask. And as you know, a homemade mask does not offer the protection that an N95 offers, but that's what we need to use. So the N95s are left for people who are healthcare workers. So I would like to share with you that I strongly recommend not having your hair down to wear the mask, because it also makes your face itch any hair that touches you. So the first thing that I am going to do is I am going to tie my hair. And then after that, I want to show you the mask that I'm using. I made it myself. So it's the universal template, I think, or pattern, and it has a pocket in it. So I use a paper towel inserted there. I know that other people recommend or like to use a coffee filter, anything that adds to another layer for the air to go through. It's a good idea. It is important that you can breathe, right? So that's something that you want to be sure that it allows you to be comfortable. So I put it in, and what I do is I change the paper towel every time that I wear my mask, and then I make sure that it's in the right place, and it's expanded, and this one, it's a little tricky to. So it does take a little bit of time to make sure that it fits you well. And this one has a shoelace, because I couldn't get any elastic, but it works okay for me. So the key thing is that you do want it to be tight, right? And really seal as much as possible of the contact between your face and the mask. And I like to do this before leaving the house, so I can look at a mirror, because it's not so easy to have it exactly fitting to your face. Okay, and I want you to be sure that, I do test that it is smooth, and it's as tight as possible without being uncomfortable, and doesn't leave any pockets, right? I would recommend that before putting your mask, you wash your hands, because again, you are very close to your mouth and your nose. So let's say that I went out, and now I am back, and I need to remove my mask. And it's very important to remove it correctly, because you've been so careful trying not to expose your nose and your mouth. And then if you take out the mask the wrong way, you are going to bring all the contaminants again back to you. So what I recommend is that you go in the back and you pull the string, right? And then what you do, I'm looking for, okay, so you pull this and you make it bigger or wider, so you can remove your mask like that. You use one hand and you never touch the front of the mask, right? You will put it in the outside. What I do usually is I leave it in the outside of the house, and the next thing I'll do is I will wash my hands to be sure that everything is as clean and uncontaminated as possible. Thank you.